Is fibromyalgia linked to lupus, SLE, autoimmune disease? Imagine living with pain that feels like a constant ache all over your body, along with fatigue and brain fog. You might wonder if these symptoms are connected to other health issues. One common question is whether fibromyalgia is linked to lupus, which is an autoimmune disease. Let's explore what science and medical experts say about this. Fibromyalgia and systemic lupus erythematosus, or lupus, are two different health conditions. Fibromyalgia is a chronic syndrome characterized by widespread pain, fatigue, and cognitive issues. It mainly results from how the central nervous system processes pain signals, making the brain amplify sensations of pain and discomfort. Lupus, on the other hand, is an autoimmune disease where the immune system mistakenly attacks healthy tissues, causing inflammation and damage to organs like the skin, joints, kidneys, and heart. Research shows that fibromyalgia is more common in people who have lupus than in the general population. Studies indicate that about 22% of individuals with lupus also meet the criteria for fibromyalgia. This means that nearly 1 in 5 people with lupus may also experience fibromyalgia symptoms. The reason for this overlap is not fully understood, but it is believed that both conditions can coexist because they share some symptoms, such as widespread pain, fatigue, headaches, and cognitive difficulties. It's important to note that fibromyalgia symptoms do not necessarily reflect lupus disease activity. This means that even if a person's lupus is under control or in remission, they can still experience fibromyalgia symptoms. Conversely, lupus symptoms like rash, fever, or hair loss are more specific to lupus and are caused by immune system activity. Because both conditions share symptoms like pain and fatigue, doctors sometimes find it challenging to distinguish between them, especially when they occur together. When someone has both lupus and fibromyalgia, it can complicate diagnosis and treatment. Doctors need to carefully evaluate which symptoms are due to inflammation from lupus and which are related to fibromyalgia. Proper diagnosis is essential because treatments differ. Lupus often requires immunosuppressive medications to control inflammation, while fibromyalgia management focuses on pain relief, physical therapy, and lifestyle changes. Understanding this link is helpful because recognizing fibromyalgia in lupus patients can improve their quality of life. Addressing fibromyalgia symptoms separately from lupus activity allows for more targeted care. It also highlights the importance of a comprehensive approach that considers both autoimmune inflammation and central nervous system sensitization. In summary, fibromyalgia is quite common among people with lupus, with about 20 to 22% affected. While both conditions share symptoms like pain and fatigue, they have different causes. Fibromyalgia does not reflect lupus activity but can add to the overall symptom burden. The coexistence of these conditions can make diagnosis and treatment more complex, so careful clinical evaluation is key. Being aware of this connection helps healthcare providers better support patients by addressing both autoimmune and pain-related issues. Always remember, if you suspect you have either condition, consult a healthcare professional for personalized advice and management.